Ivermectin is best known for treating parasites in livestock, and in human form as a treatment for skin conditions like scabies, it's been taken safely by billions of people. Trials conducted across the developing world have also revealed ivermectin to be an effective treatment for COVID-19, reducing symptoms, cutting mortality by up to 75%, and even inhibiting transmission. In parts of India, it's been credited with bringing COVID-19 infections down to manageable levels, while authorities in Uttar Pradesh have announced they'll provide a protective dose to every devotee attending the Magh Mela festival on the banks of the Ganges River next year.
For countries like us, it is a wonder drug because it has a long history of use in Asia and Africa. Many of the countries where obviously apart from they cannot be at home for a long time, they have to go for work and they have to cure themselves, and this is a very cheap drug, an affordable drug which is less than $2 or the full course.
A group of doctors in the United States, collating data from studies like Dr. Khan's in Bangladesh, now believe ivermectin should be put to immediate global use.
It works not only at prevention, early treatment, but it even works late phase in the hospital. Even patients on ventilators have shown improvement when they get ivermectin. And at that point, it's not the virus replicating, it's all severe inflammation. And so what I say, and what I've said to colleagues and what we believe in my group, is that if you were going to design a drug for all the phases and the pathophysiology of COVID, ivermectin would be the drug.
The wealth of data that exists on ivermectin hasn't yet encouraged many rich world medical regulators to act, in part because the focus here has been so squarely on vaccine development, and in part because of an apparent reluctance to accept low-budget developing world data. But as the virus mutates into more lethal strains, and as concerns grow that vaccines alone may not be the long-term answer, so interest is building in ivermectin, with its potential to be both prevention and cure. So much so that researchers at Oxford University are conducting a trial of their own.
Although we're hopeful that vaccines are going to do what's promised, the data is not very reassuring that they're actually going to achieve everything that they're setting out to achieve. But if they don't, we'll have another tool as a backup. And as one that we can deploy now while waiting for the vaccines, right? There's huge portions of the world which don't have anything available to protect them or to treat them.
After intense lobbying by healthcare professionals, Slovakia this week became the first EU country to approve the use of ivermectin as a treatment for COVID-19. Wider use may not be far behind. Jonah, Aljazeera.